So as a dentist, we're now practicing in a modern world where there is growing amount of evidence about treatment options. The days when a denture or a bridge would be offered to a patient because it was the only realistic option have gone. We now, as you know, have a responsibility to share with patients all treatment options. So we can no longer offer a patient the treatment that we prefer to do, or the treatment option that's the simplest one, because the patients now have a right to expect to be given enough information to make a decision themselves. Take, for example, a single missing anterior tooth. Of course, some patients might prefer no treatment, but they need to know the consequences of that decision. They may prefer an adhesive bridge, they may prefer a conventional bridge, but they need to know the consequences of preparing teeth for crown and bridge work. And they also need to know that implants are there and what modern research shows about their success in the long term. What we aim to do is to help support local dentists by giving enough information about implants so that your patients can be offered that as an option as well. I'm often asked by referring colleagues, is it better for me to take the tooth out or for you, the referrer, to? Well, the answer to that varies. Of course, when I'm extracting a tooth, I can get some valuable information at the same time. I can determine whether the infection is all clear, I can assess adjacent bone for suitability, I can get some feedback about the quality of the bone and also the volume of bone that's there. So I do prefer to do the extractions myself. The other answer, of course, is that sometimes I can place an implant at the same time. As you know, alveolar bone is volatile, particularly in the maxilla, and leaving a socket to heal for a period of months might reduce that critical amount of bone and therefore make treatment more complicated and more costly for the patient. Another frequent question is it a straightforward implant or do we have to do other things? We have a lot of other techniques available to us. We can do block bone grafting, moving bone from one place of the mouth to another, or occasionally from other parts of the body to the mouth, to improve the volume of bone for implant support and for soft tissue support. We can do guided bone regeneration, where we can build bone with artificial materials and again encourage a much better shape, which will look nicer, might be easier for the patient to maintain. Of course, the majority of implant treatments are quite straightforward, but it's important that we have other techniques and tools available to us so that we can treat a broader range of patients. Block bone grafting, guided bone regeneration, soft tissue procedures, sinus lift procedures, a whole range of things so that we are able to say to a patient, yes, we can treat you, it might be straightforward, but if it's not, we can offer all the techniques and procedures that you will need. To help patients understand what's involved and the terminology we use, we try to use very simple words, and we also use a lot of animations so that they can see a procedure to get some idea what's really involved. Of course, having explained to patients what's involved and what options they've got, it's important that you know what we've said as well, so we send a copy of our detailed treatment plan to you as well. At the end of a course of treatment, of course, we return your patient to you. We like to make sure that that implant treatment, whether it's simple or complex, is maintained and monitored in the long term, and we provide that service, again, to support you looking after your patient. To help you and your team understand how you can use implants in your practice, we're very happy to support you. We will come and provide training to your team so they have some understanding about what implants are and what they can do. We provide training here so that you can come and learn how to restore cases, and we'll also provide information on how to get the best information from CT scans and other diagnostic procedures. We also provide hands-on training to give you experience having used the instruments and implant components so you can use those simple techniques for your patients.